I'm Dr. Aftab Khan. I'm a cardiologist from Apollo Multispeciality Hospital, Kolkata, India. So this is my almost the fifth year that I'm here for the IPDI conference, and it's been a wonderful experience each time. I think the organizers need to be congratulated for having put up a wonderful scientific session. But more importantly, it's an interactive scientific session, and that's what is most important. So it's a learning curve for juniors to get involved, and also it gives a chance for people to interact so that they have the masters who are here and everyone can learn from them. So it's a wonderful conference, very interactive, and that's what makes this conference so lively and a pleasure to come back each year too. So I think we have to understand that the pattern of practice and the patients in India and Bangladesh is almost similar. We share the same genes, we share the same dietary habits and certain risk factors that are common to this part of the continent. And therefore, it's important for us to realize that the challenges that we're facing in India are the same that patients here in Bangladesh are also going to be facing. We all are now facing and treating a much aging and more complex patient population. Patients who have more of multivessel disease, patients who have CKD, patients who are elderly. And for all these group of patients, imaging becomes that much more important. It is important that the young clinicians and young interventional cardiologists get themselves trained into the use of imaging, because that has been shown in many clinical trials to improve survival and to improve the end results both for patients as well as to make the patients the procedure less complex and less complicated for the performing physician also. So I think that's one aspect that I would encourage all the young and the upcoming cardiologists to get involved in, and to make sure that they do play an important role in making sure that they pick up the skills that are needed for interpreting imaging, which includes intravascular ultrasound, which includes OCT and other modalities which thereby help us to treat our patients better. We have a diverse audience of physicians who are at different levels of their clinical training, and it's important that we make this conference more interactive. I think the organizers have done a wonderful job of keeping a quiz and of having an interactive time that is allocated to the audience for them to interact. And therefore, I would still again re-emphasize the fact that what is helpful to many of our junior consultants or junior interventional cardiologists is a chance for them to interact, a chance for them to learn from real cases. So rather than didactic lectures, what is most beneficial is live cases. What is beneficial is to basically have an interactive session where we can showcase our cases and have discussions on live cases.